Good afternoon, everybody, and welcome to the CHPR seminar series. My name is Jeffrey Hotch. I am a professor of health economics and the associate director for the Center for Healthcare Policy and Research, and welcome to this seminar today. We have this as an EPI 291 class. This is also a CME credit opportunity, and it's also a chance to hear about really interesting research from a very accomplished speaker. Today we have Dr. Brittany Chatterton. She is an assistant clinical professor in the Department of Internal Medicine at UC Davis Health. She is the medical director of the Population Health System Learning, Evaluation, and Dissemination Group. Additionally, she serves as the lead research faculty for the Avenue M Pathway to Medicine program at the UC Davis School of Medicine. Her research focuses broadly on primary care delivery in the outpatient setting. And today her talk is going to discuss 1, the types of errors reported in medical literature publication, 2, how to examine literature for corrections, and 3, errors related to COVID-19 therapeutics. Dr. Chatterton, thank you so much for giving your talk today and being patient with us as we sort through IT issues.
Thank you so much for having me. I'm excited to talk to everyone today. So as Dr. Hodge said, I'm Brittany Chatterton. This topic is a little outside of my normal scope of primary care. I'm an internist, so I love primary care research, but this was just such an interesting topic, and I hope you guys find it all interesting as well. So the title of my talk is the title of my paper that we published, Does Haste Make Waste? Looking at the prevalence and types of errors that are reported in publications of studies, specifically looking at COVID-19 therapeutics. All right, let me make sure I can advance. Okay, so I don't have any financial disclosure or personal disclosures. And like Dr. Hodge said, there are 3 main objectives for this talk. So the first is that I hope you can come away with being able to identify the type of errors that are reported in the biomedical literature publications. The second one is to understand how to examine literature for corrections. And then the third is to recognize the errors related specifically to the COVID-19 therapeutic publications. So to kind of get us started, when we think about published biomedical literature, as you're all aware, this is the main mechanism that we're utilizing to communicate research results with other scientists as well as the general population. But kind of the question that comes up is who kind of polices for accuracy within the published literature? So if we think about this in kind of different groups, the first is the author. So it is the author's job and to hold integrity with the work that they are publishing. And it should be of strong scientific rigor and validity. It also there should be transparency in their work as well as a clear and concise reporting that's accurate. The next layer we really think about is the editors and the peer reviewers. So these are really the gatekeepers for publication. So they're expected to look critically at these manuscripts that are coming in, looking at the study methods that were used, the results, and the conclusions that are drawn, and to ensure that what's being reported is accurate, of good scientific rigor, and can be disseminated out. And then if we think about after a paper is published, kind of the fourth group that plays a role is the readers. So readers can raise questions in terms of the findings of papers, and also alert the journal if they find errors within the written record. So really, if we think about it, this is looking at the biomedical literature, this is a self-regulating system where the authors, the editors, the peer reviewers, and the public, the readers, really are all playing a role in taking a critical look about what's being put out. But inevitably, we're going to find errors within the record. So what are those errors? So some of the error types that we can think about are kind of categorized as follows. So there can be topographical errors. So these can be minor things such as spelling, punctuation, formatting, and they may not contribute to a change in the effect of the overall findings of a study, but they could cause confusion for a reader or cause misinterpretation of the data and therefore become important. We can think about factual errors. So these would be errors that are included in how the data is presented, such as an example of maybe the wrong odds ratio was put in because something was transcribed incorrectly. In terms of the author details, a common thing that gets corrected is the spelling of authors' names, or maybe their affiliations are not done correctly, or perhaps there's an issue with the conflict of interest that were disclosed or not disclosed. If we think about tables and figures, sometimes figures are added incorrectly, like the wrong figure shows up within a paper, or data is labeled incorrectly within a table. And then the last category, just thinking about references, perhaps a wrong citation was noted. So within these types of errors, they are when they are found and they are found to be significant where it needs a correction to happen, those get published by the journal, and the corrections that come out have their own citation. So it's indexed as a separate correction to the actual paper, and they have different names in terms of when they get published. So the first one, the erratum. So this one generally is a term that's used when the publication error is due to something that happened from the publisher themselves. So something when the paper was getting copyright written, or something that in the production of it an error occurred. The next one, the car. The next one is basically when the issue is actually with the author themselves, and in terms of they made an error. So it could be that the author accidentally put the wrong figure in, or they made an error with in the data in terms of reporting on a table. Then the onus is on the author actually letting the publisher know that they found it. And then the term correction is just kind of used universally as in journals, and sometimes they just call it a correction. Those terms can be used interchangeably, but historically are kind of parsed out. So after these errors get noticed by the journal, and it's deemed that this is an error that is going to change, needs to be addressed because it's either changing the findings of the study or causing confusion, then the erratum gets published. And within an erratum, it can be one item that's getting addressed or a whole multitude of different items. So they could have several different items. Hopefully there aren't that many errors, but you can have, there isn't a cap to how many can get published in one single erratum. And then in thinking about categorizing the errors, so we think about them I think about them across a spectrum. So there are minor errors that occur, there are more major or serious, and then the one that would be the worst would be a retraction where the full paper is removed. So if we're thinking about more of a minor error, these were things like name misspellings for authors. So obviously that's not changing the result of the paper, but we want to make sure we know exactly who authored the paper. And when you go to look it up, you want to make sure that the spelling is correct so that you can attribute it correctly. Something that's more of a major or serious error would be, an example would be like a graphical error. So say the wrong graphic was actually published, and then that could lead the reader to draw incorrect conclusions because the wrong figure was included. And then if we think about retractions, that would be the most extreme example of an error where it's so major that the entire paper now needs to be pulled, rather than being able to issue an erratum where it will just directly address what the error was. So then when we're thinking about the effects that these errors have on the published medical literature, like why do we care? Why are we having a whole talk about this? So I'll start with first the retractions, just to kind of give you a couple examples. So like I said, in a retraction, the entire paper is pulled. So this is a public notice that the journal or publisher is indicating that the article is no longer to be part of the scientific literature. So this can happen for a variety of reasons. It can happen because of scientific misconduct. So maybe there's falsified data that comes out later that they realize. There might be major errors where there's conclusions drawn that are inappropriate to the data that was actually presented, or it could be because of ethical violations in terms of how the subjects were actually treated in the course of the study. The thing that I think is really interesting is you're able to pull retracted articles in their full form. The difference is when you go to look for them online, there will be a watermark that says retracted. So this journal, this paper from the Lancet, this retracted is a watermark on it. And the idea behind keeping it available online is so that it's still part of the scientific record so that the paper couldn't theoretically come back again. So we already know that it's there and it's been retracted, but it is interesting that you can read the full paper and it's available. So I have two examples on this slide. The first one I couldn't resist putting on here. So this one is from Andrew Wakefield's paper that asserted that there was a causal link between the MMR vaccine and autism in children. This paper was like earth-shattering at the time when it was published in 1998. And basically, it was a case series of 12 children, of which 8 of them had autism in the study. And this paper was later retracted. The retraction, interestingly, came in 2010, so 12 years after the paper was published. But the reason that it ended up being pulled and retracted was that the study was a very small sample size. There was actually conflict of interest between Andrew Wakefield and receiving money from a group of lawyers who were actually doing a case against the manufacturer of the vaccine. So huge conflict of interest in terms of them funding his study. And then they also found that he misreported data within the paper and also the clinical histories of the patients in the paper as well. And then they subsequently did several studies that were at large scale. Remember, this is only like 12 children in this study, and didn't find any association between the MMR vaccine and autism. But this paper has had a huge impact. So even to this day, there's still a lasting effect, and there's a lot of vaccine hesitancy because of this paper. So even though it's been debunked and we can see clearly that this was not done appropriately, once it's out in the public and it's been publicized, it's very hard to then retract back. And then interestingly, clinically what happened is a whole bunch of people stopped vaccinating their children, and then we got measles outbreaks. So clinically, that is what occurred. So huge measles uptick after this paper was published. The second paper is more in line with what we were interested in terms of COVID-19 therapeutics. So this paper was retracted, and you can see this one's this retraction and how it's identified is from PubMed. So this is looking at hydroxychloroquine and azithromycin, which was hydroxychloroquine was like the hot medication that was going to solve all of COVID's problems. So this was a paper that early came out and ended up being retracted because of methodologic issues. So this is an interesting paper because there's no control group. I mean, it does say this is a non-randomized clinical trial. So we don't have any control group to compare these patients, these COVID patients to. So that's first not helpful. The second one is they found out that they took in their sample of patients. They excluded patients that died or clinically worsened. So they created this very nice survival bias by making a very clean cohort of patients. And then interestingly, the paper doesn't have actually any clinical outcomes. So it only looks at the viral load at the PCR level, but doesn't actually look at how these patients do clinically. And if you're treating a patient, what you want to know is how clinically they're doing. So after this paper came out, there were major issues, obviously, in terms of the methodology that was used, and it ended up being retracted by the journal. And they did follow-up randomized trials and saw that there's actually no clinical improvement with using hydroxychloroquine or azithromycin, and you actually have negative impacts on the patient. So those are both very extreme examples of errors in medical literature, but you can see how they can have a lasting impact. I did actually have a patient telling me about hydroxychloroquine, and I was like, we're not using that to treat your COVID. So once it gets out, it's very hard to pull back from a public viewpoint. So obviously those are clear why those ones are important, but then you might be asking yourself, well, how do these minor or major errors in the literature, how do those have any kind of effect, or what would be effect? So I'm going to tell you a little story because I'm a clinician and I love cases and I love to tell you about patients. And I always think about things in terms of treating patients. So this case, just so you know, this is inspired by true events and was kind of the catalyst for what got us started thinking about actually doing the paper that we did. So I'd like you to meet Mike. So Mike is a middle-aged gentleman. He's very interested in staying healthy, and he recently started weight training, which is excellent. Unfortunately, his core muscle strength was pretty poor when he started, and he was a little overzealous and started lifting pretty heavy too soon. And he developed an inguinal hernia because of this. So just to make sure we're all on the same page in terms of what an inguinal hernia is, when the abdominal wall is weak, the bowel can push through into a space called the inguinal canal, which is down in the groin area. And a hernia is really just anything anatomically that's just not in its right location. So bowel should be in the abdominal cavity, not in the inguinal area. So that's where that term hernia comes from. And typically when patients have inguinal hernias, they can have pain in the groin area, and it can occur with different activities. So Mike comes in for an appointment and explains that he's having some symptoms of pain. It's not all the time, but sometimes he has to modify his activities because of the pain. And so he's wondering what the best treatment option is, non-surgical versus a surgical intervention. So he's sitting there, he's pondering this. And so he comes into your appointment. And your first instinct, because you're an internist like me and don't have this literature top of head because you don't do hernia repair surgery, is to quickly jump on the computer and see if you can pull up some literature to try and help you. So you go to JAMA's website because you want to go to a reputable journal. You pull up this site, this paper. You see, wow, this one's been cited quite frequently, 305 times. Okay, that sounds good. You see that this is a randomized controlled trial. So we're talking top-notch study design, which is excellent. And the paper topic is watchful waiting, which is a really nice way of just saying we're not going to do anything at all, versus repairing a hernia, which would be surgical. So you look at the paper, and like any clinician, you just jump right to the abstract and you're skimming down and you're trying to find the results section. So you skim down, you find the results section, and you see, oh, perfect. This is looking at an intention to treat outcome. We have watchful waiting, which is we're going to do nothing, versus surgical repair. And the outcome that they're looking at is pain limiting activity. Perfect. Our patient, Mike, that's where the question is. And you see that between the watchful waiting group and the surgical repair, it's reporting a p-value of 0.52. So no difference. So you think, honestly, if there's going to be no difference and we would be doing surgery really to try and help this pain limiting activity, this pain that would limit your activity, then it's probably a better idea not to do surgery because there's no difference and you're going to have risks associated with the surgery. So we probably shouldn't do that. So he's a little disappointed, but says, okay, that sounds good. So then later that night, you decide, actually, I probably should go back and read that paper a little more carefully because I read it pretty quickly. And this time you go to PubMed to find it instead of going to JAMA's website. And when you go to PubMed, you realize as you look down at the title, you see it says that there's an erratum. And you think, that's interesting. I don't think I saw that when I was looking at the article originally. So you pull up this citation, it takes you back to JAMA's website, and then you have to scroll down to the correction section, and this is the correction that was issued. So what this tells you is that there was an error in the results section in the abstract, and the value that they reported for their p-value for pain-limiting activities should have been reported instead of a p-value of 0.52. It should have been a p-value of 0.06. Well, that's interesting. So that would mean that the patients that were in the watchful waiting group, although it's not significant, it's pretty close to being significant, had more pain associated with needing to modify activities than the patients that were in the surgical group. And then they also note that this p-value was incorrect actually in the body of the paragraph or the body of the paper as well. So not only the abstract, but also within the text. So now you're thinking, well, that can change the nuanced conversation when I had with him. Because when I had originally seen it, I had thought, well, this is definitely not significant. I definitely shouldn't recommend this. Well, now maybe we should have considered this more. This kind of changes clinically what I might want to do. So then the next question is, did I just miss this on the JAMA website? Like, how did this happen? So you go back to JAMA and you look all over the article and you don't see anywhere listed that there's a correction, which is a little bit concerning, especially given the high number of citations of this paper. So then the question becomes, is this just a one-off? Did I just happen to pull a paper and there was a correction in it, or is this something that happens frequently? And so the next question is like, how frequently do these errors occur in the literature? So as part of my study, I actually tried to look at other papers that kind of looked at error frequency in the biomedical literature. So what you can see is that these are the source papers that I was able to pull it from. These were the years of which they examined papers. These were the journals. So you can see, depending on which study, there's a variety of journals. So this one looked at like the top 10 general internal medicine journals and top 10 cardiology journals, versus this one just looked at basically the top 5 journals. So JAMA and New England Journal. And then they looked at different article types. So there's a lot of heterogeneity when we're looking at air frequency, but this kind of gives us a sense. And then over here, you can see for the published errata rates that there's anywhere from 1.7 up to 19 errata per 100 articles, depending on how many journals you're looking at and how many article types that are included. And then the question was like, okay, well, if there's that many, how many of them are serious? And by serious, I mean, how is this something that's going to really affect the reader or the outcomes of the study? And you can see that the rates here are anywhere from 16 to 24 per 100 errata are actually serious in terms of them. 6 to 24 in terms of them actually changing maybe the outcome of the study and really needing to be corrected. So that brings me to the study that we looked at, and that was looking at COVID-19 therapeutics and the biomedical literature. And so what we wanted to do was, what we were thinking is, obviously there was an unprecedented amount of research coming out around COVID. And there was also this really big push to get things out very urgently because we needed to know about these therapeutics and how to treat our patients. So we hypothesized that given these factors of this novel virus that's producing all of this work and its need to be disseminated very quickly, that it would really put a lot of stress on the editorial and review process and lead to a higher amount of serious errors within the literature. And just for context, so that you can kind of understand the change that occurred during COVID, there was a study that looked at the time from manuscript submission to publication. And so on average in non-COVID literature, it can be around 106 days from when you submit to when you get when it gets out and get published. But the turnaround time for COVID-19 articles decreased by tenfold and was around an average of 11 days. So this turnaround time is super rapid. So what we did to look at this was we did a systematic review. And like I said, we chose specifically the COVID-19 therapeutic articles as our target to look at, because as a clinician, that would be what I'm most interested in. And we felt that this would be obviously what clinicians were looking to the literature the most to find answers about. So we did our review by searching both Medline, which is what feeds into PubMed, and then Embase as our two database searches. And we looked at publications between January 2020 through September of 2022. And then we examined each article erratum pair that we came up with. So what we did is we took each pair that we found and then we looked at 3 different categories. Where was the error located in the article? So was it in a prominent area like the title, the abstract? Was it in the body of the manuscript? Was it in a table or a figure? Was it a reference issue, or was it something with the supplemental material? Then we looked at which type of error it was and categorized which error type. And so those types are located in the table right here. So looking at, was it an issue with the author disclosures, the author attribution? Was it a numerical or statistical error, something contextual, a citation error, or interpretation error? And the interpretation error would be describing if the analysis was done correctly, but then the way that it was written in the text, there was an error with how they interpreted the data that was done correctly. And then the last thing that we looked at was the seriousness of the error. And so looking at prior literature, we tried to get a definition of that. And what we settled on was a serious error would be one that would affect the study results in a way that would lead to erroneous conclusions by either the author or the reader, and that the error would also be considered serious if it was found in a very prominent area, such as the abstract or title, where it would increase the risk of error propagation by being on that first glance when you looked at it. And so myself and my co-author, we coded everything separately, and then we had a third author that adjudicated everything that we coded to make sure that it all matched up. And so what we found was in our initial search, we had 117 articles. We ended up removing 124 of those on our initial search, mostly because we couldn't find the associated erratums with them. And that left us with 47 articles, which we then looked to see if they met our inclusion criteria. And what our inclusion criteria was we were looking for published clinical trials, observational studies, or systematic reviews. And we're looking at COVID-19 treatment in a head-to-head comparison. So a treatment versus placebo, or a treatment versus standard of care or supportive care. And they have to have an associated published erratum with them. So then that left us with 18 articles that met our inclusion criteria. So you can see the majority of them were clinical trials, so 83%, 11% systematic reviews, and 3% or 6% observational. The majority of them were published in 2021, which was kind of the peak. And then we looked at the journal impact factors to see if that played a role in the number of errors that were reported. And just the impact factors are a way that journals are sometimes categorized in terms of top tier journals. And what it is it's looking at papers that are published in their journal, and then how frequently are those papers then cited. And so it's a calculation that creates this impact factor. So the higher the number, the more impactful, quote unquote, impactful the journal is. It's a little controversial, but we use it. So we can see that in our journals with an impact factor of 10 or more, that's we can see as the journal impact factor increases, we can see an increased number of these errors that are occurring. And then we looked at the geographic area of where the papers were coming out of, and the way we determined this was looking at the first author and where they were, their affiliation was with. And we see that half of them were coming out of Asia, which makes sense because that's where most of the literature started to pour out of first. So then we looked at the errata. So that was the articles. Then we're looking at the errata. So there's 19 published errata. So one of the papers had 2 separately published errata, which was interesting because, like I said, you can have as many corrections in an errata that gets published, but they published the first one and then they found more errors and then published the second one. So you can see the time. So this is from the time that the paper was published to when the errata was published. So you can see it's kind of broken into a third. So within the first 2 months, about a third of them. By the time we're at 120 days, another third. By the time you're out to 240 days, you have another third. And so that would be around 8 months. So the goal with the journal is to get the correction out as soon as possible. So when we did a median of this, our median was about 76 days, with the earliest being about 12 days later, 12 days after publication. And then we had one that was like 540 days after publication and got a correction put in. And then the second thing we wanted to look at was if the correction was actually published online. And so you see that half of the time it's not. So that means like the JAMA article that I showed you, the correction is not in the actual article. This is kind of a busy table, but what I did was we looked at the type of errors. So these were all the different types of errors. And then we looked at here where they were located. And I'll just, as you can see, this is a lot more than 19 because, as I said, there can be multiple corrections in a published errata. I'll just direct your attention. Conflict of interest seemed to be a problem. So this is that the authors did not disclose conflict of interest at the time that the paper was published, and then a correction put out to let you know that there was actually a conflict of interest. And then most of our numerical and statistical errors were occurring in tables and figures. And so then this is just to give you an example of what the type of errors were and looked like. And I'll just point out this serious one that we found. So this was an interpretation error. So in the results section of the abstract, it said that there was severe adverse events recorded in the study group, and the actual correction was there were no serious adverse events recorded in the study group. So obviously that is a really big difference, and if you're just skimming an abstract looking for a therapeutic and you read that, you might just go over that study and go to the next one. So in conclusion of our study, we found that there were 18 articles with 19 published errata. Our calculated serious error rate was 5%. So that was in line with what other published literature and non-COVID papers were. And we were actually pretty surprised by this. So what it kind of told us was, even though there was an increased pressure to expedite the research and disseminate these for these journals, they did actually uphold their publication standards in terms of this groups of papers that we looked at. And then one thing that would be kind of nice is if the journals could give us some transparency about what they did during this time to allow such a quick turnover for this research. And perhaps we can do things for our non-COVID research to be able to disseminate information more quickly. And then I just want to kind of, in closing, kind of look at where you can find the errors in the biomedical literature. And so just quickly, if you're looking for the erratums, so PubMed is the good place to go for them because they're actually indexed here, and you can do a search term to look for erratum in it, but they actually will publish corrections. And so let me show you, this is that same paper that I showed you in the case for JAMA. And if you look at the abstract in PubMed, they actually correct the p-value in the actual digital copy of it. So interestingly enough, it's not in the JAMA article if you actually go to the website, but on PubMed it is. So it's a good place to go to look for things. And then if you're more interested in retractions, which I mentioned, obviously it wasn't within the scope of my study to look at retractions as well, but there's a website called Retraction Watch, and you can just type in a search result to look for certain articles depending on what you're interested in. I put in COVID-19, and it will show you all the papers that have been retracted with that subject matter. So with that, so I hope with this that you can take away that there are errors in literature and you can classify them as minor, major, or retractions. And that the minor and major retractions that get published are published corrections that are indexed that you can find, and using a search engine like PubMed is the easiest place to locate them. And that despite how quickly we turned over the literature for COVID-19, we were able to maintain our standards compared to our non-COVID literature. So these are just my co-authors of the paper I just want to acknowledge, and then I'm happy to take any questions in the remaining few minutes we have.
Thank you so much, Dr. Chatterton. This is fantastically interesting research, and you present so well, very engaging. I had no idea before what an iguana hernia was. I don't have a lot of vet friends, but thank you so much for talking to us, making it understandable, come alive. If there are questions, people can turn on their cameras, they can do the actual hand raise, the virtual hand raise, they can type stuff in the chat. While we are waiting for our shy group to potentially contribute, I wonder, especially for the students who are going to be watching this, could you talk a little bit about your evolution, if there has been one, from how you might have looked at the research and research in general, you know, many years back, to how you look and engage with research now?
Yeah, so I think as the time has progressed, I think looking at the literature, I'd never really thought about looking at errors, and it made me kind of question, especially when I'm going to cite things, am I citing the actual correct paper and or am I just propagating this error that's there? So it made me kind of question that, because it's something I never really thought about until this actually came up. And that paper that I shared in JAMA, that was kind of the catalyst for doing this, and to kind of actually looking at it and just thinking about, yeah, clinically considered, you could think that's just a minor topographical thing, but it can have a big clinical impact. So yeah, it made me really think about that. And then also within my own research, just really trying to make sure that I am being extra thorough and doing those double checks before it goes out for publication when I get that final copy.
What do you think it means that higher impact journals seem to have more mistakes? Are we making a mistake labeling them high impact, or perhaps there's something else?
I know. I think it is interesting. I think, well, part of it is the volume of articles that they're doing, right? So they are publishing a high amount of journals. So some journals are only coming out with monthly, others are coming out weekly. So I think that's part of it. You know, and I think too, there is sort of a rush sometimes, because those journals do tend to get you your rejection quickly or your acceptance pretty quickly. So maybe there's something to say with that. But I do think it has to do with just the volume that they're seeing in comparison to other journals. And I think it also just makes you just take a step back. Just because it is published in these high impact journals doesn't mean there isn't necessarily an error. So I think you do have to still keep your investigation hat on and not just take everything at face value.
Those are such cool thoughts. I love this research. We've got one comment coming in, and then after I read the comment to you, I'm going to ask for your final thoughts for today. So the comment is in the chat. It's Talon writing, here's an interesting narrative article about the impacts of propagating findings without knowing the evidence base. It's relevant to COVID-19, and it's from Wired, and it's in the chat, folks who are interested in that. And with the remaining 1 minute left, Dr. Chatterton, can you share with us what you think ought to be the final thoughts from today?
Yes, absolutely. I think thinking about COVID-19 and thinking about these therapeutics, I think the editors and peer reviewers had a really hard job to do because, like we're saying, there isn't a basis to go off of. And so I think a credit to them for trying to get the research out to the general population. But I think it is really hard when you don't have a basis for it. But obviously they did a good job and kept it within what we would expect, given the other literature. So just as you're going out and doing your literature searches, just make sure you pay attention to getting to those corrections. It can be a little cumbersome sometimes to find them, which I hopefully at some point it will be a universal system and they'll all be doing it the same. But just make sure that you keep that in mind because it could change how you look at a study.
Excellent. Thank you very much, Dr. Chatterton. Thank you so much for your talk and your patience today. Bill, can you handle the question in the chat about CME? Dr. Chatterton, we're able to follow up with you, right, if we have questions about your work?
Absolutely. Happy to take any emails.
Super. Thanks for sharing your time and your expertise and your findings with us. We really appreciate it.
Thank you so much.
Bye for now.
Bye.
Thank you, everyone, for joining. Hopefully we'll see you next week.
Thank
Take
you,
care,
and
everyone.
please see my note in the chat.